the fractures of first metacarpal bone. Okay, so the first metacarpal bone, a small anatomical tip about first metacarpal bone. So this is trapezium, and this is the first metacarpal bone. The first carpo-metacarpal joint. The first carpo-metacarpal joint is an example for saddle joint. Is an example for saddle joint. It is an biaxial joint. It is an biaxial joint. It is an biaxial joint. It is a saddle joint. Okay. Now what happens is, to the base of the first metacarpal, to the base of the first metacarpal, there is one important muscle which is getting attached, and this muscle is called as abductor pollicis longus. This muscle is called as abductor pollicis longus muscle. Okay, so you got thumb. In this thumb you got first metacarpal. The first metacarpal base, you got a ligament, a muscle which is attached, is called as abductor pollicis longus. Only when the abductor pollicis longus contract, you will be able to abduct the thumb. The abduction la theriyala ungalku. The thumb. Okay, so if you see the hand, this is the plane of the hand. My thumb goes like this. The thumb goes back, it is called as adduction. Okay, if my thumb goes across the palm, it is called as flexion. If it goes away from the palm, it is called as extension. So abduction is this, adduction is this, flexion is this, and extension is this. Okay, so these are the movements in the thumb. So in the thumb you have got only two phalanges, distal phalanges, proximal phalanges, and you have got the metacarpal bone. The metacarpal bone has got a muscle attached here, that is the abductor pollicis longus. So when it contracts, the thumb goes like this. So this is abduction. Okay, clear. So that is the metacarpal bone with the muscle attached here. Now what happens is, sometimes a small fracture can occur like this. Okay, so this is partial articular fracture. Partial articular fracture, because it involves only part of the joint. Partial articular fracture of first metacarpal is called as Bennett's fracture. Is called as Bennett's fracture. Is called as Bennett's fracture. Okay, clear. Now just imagine when this has got fractured. Now what happens to the rest of this bone? Because of the pull of this, the bone gets displaced. Okay, so in Bennett's fracture, there will be displacement of first metacarpal. There will be displacement of first metacarpal. So two things in Bennett fracture you should remember. It is a partial articular fracture. It is not a complete articular fracture. It is a partial articular fracture. Whenever Bennett fracture happens, because of the pull of the abductor pollicis longus, the first metacarpal dislocates. Okay, so displacement of first metacarpal bone is seen in Bennett's fracture. There is another fracture. So that fracture is a complete articular fracture like this. Clear? So there is a fracture part here, there is a fractured part here, and there is a fractured line. So this is a complete articular fracture. Complete articular fracture of distal part of the first metacarpal bone is called as Rolando's fracture. It's called as Rolando's fracture. Clear? Any doubt in this? Rolando's fracture, any doubt? So what is the difference between Bennett's fracture and Rolando's fracture? In Bennett's fracture, there is partial articular fracture, whereas Rolando fracture, it is complete articular fracture. Now in Rolando's fracture, no displacement happens. In Rolando's fracture, no displacement of first metacarpal happens, because just see here, this is attached here, only this part can displace, the rest of the metacarpal will stay in position. So this rest of the metacarpal will stay in position, so there won't be any obvious deformity. So in Bennett fracture, displacement of first metacarpal is obvious. In Rolando's fracture, it will not be seen. So this picture will show you very clearly the Bennett's fracture causing the displacement of first metacarpal because of the pull of abductor pollicis longus tendon. Okay, clear? These questions are repeatedly asked questions. Bennett fracture is a partial articular fracture. Rolando's fracture is an incomplete fracture. It's an Rolando's fracture is a complete articular fracture. Okay, and in Bennett's fracture you will have displacement of the metacarpal, whereas in Rolando's fracture there won't be displacement because of this fact. Clear? Okay, so with this, we'll go to the next part of our fracture of the upper extremity. One is called as mallet finger. Mallet finger. What is called as a mallet finger? See, very simple. This is the proximal phalanx. This is the middle phalanx, and this is the distal phalanx. Okay, so I'm keeping my finger like this. I'm drawing the finger like this: proximal phalanx, middle phalanx, and distal phalanx. There is a muscle which gets inserted into the distal phalanx like this. This muscle is called as extensor digitorum muscle. This is called as extensor digitorum muscle. Now, this is very common when you play cricket or basketball. When you try to catch the ball can hit your finger like this, and it goes in for sudden flexion. When it goes in for sudden flexion, the tendon which is attached here can get avulsed. So if this gets avulsed, I cannot straighten. It will go in for a slight bending like this. It will go in for slight bending. I cannot be able to extending this. It will go in for bend like this. This is called as mallet finger. So in mallet finger, you got extensor digitorum tendon rupture or avulsion. Extensor digitorum tendon avulsion is called as mallet fracture. Okay, it's called as mallet finger or mallet fracture. There is another finger called as jersey finger. Jersey finger. In jersey finger, there is avulsion of flexor digitorum profundus tendon. There is avulsion of flexor digitorum profundus tendon. There is avulsion of flexor digitorum profundus tendon. So that finger is called as a jersey finger. Okay, that finger is called a jersey finger. So these are the various. Can you able to see this? So this is normal hand, normal finger. What happens to this finger? It is bent like this because of avulsion of the tendon from this point. So this finger is called as a mallet finger. This is called as mallet finger. You can treat the mallet finger by using splints. You can treat the mallet finger by using mallet splints. Mallet splints. Okay. So using mallet splint, you can treat the mallet finger. Okay. So to end this topic, we'll see one last entity regarding fracture, and that is fracture in children's. Fracture in children's. See, fracture in children is very important because what is the thing which is there in children's, which is not fused, which is not fused, which is seen here between the diaphysis and the epiphysis. What is this structure called as? Epiphyseal plate. Okay, very good. Epiphyseal plate. See, whenever there is a fracture of the bone in children's involving the distal part, it can injure the epiphyseal plate. If epiphyseal plate gets injured, then there is a chance for delayed growth. There is a chance for delayed growth of the bone. Now, the epiphyseal injuries in children's, the epiphyseal injuries in children's are classified by a classification method called as Salter-Harris classification. What is this classification called as? Salter-Harris classification, by a method called as Salter-Harris classification. And in Salter-Harris classification, there are 5 types in it. 1, 2, 3, 4, and 5 goes by a mnemonic Salter. Goes by a mnemonic Salter. You can have 6th type, very rare, but it goes by a mnemonic Salter. Okay, what does this Salter stands for? In first type, so there is epiphyseal separation. There is only epiphyseal separation. Okay, so the epiphysis gets separated. So S stands for separation. That is type 1. So this is epiphyseal separation. This is seen in a condition called as SCFE, slipped capital femoral epiphysis. In the afternoon session, we will see what is called as SCFE. Okay, the type 1 Salter classification, where the epiphysis just gets separated, that is called as type 1, and the example for that is SCFE. In type 2, so let us consider this is the distal part of the bone, and the fracture line runs through the physis and goes through the proximal part of the bone. So above the epiphyseal plate, A stands for above the epiphyseal plate, fracture line goes. So this is type 2. We'll see type 3 here. This is type 3. This is epiphysis. Fracture line goes below, lower. So it goes to the lower part of the, L stands for lower. So this is called as type 3. And T is one of the dangerous type T. It goes across through the epiphysis. It goes from the proximal through the epiphysis and through the distal it comes out. So fracture line will go like this through the epiphysis. And 5 is crush injury. It gets crushed. So this is the epiphysis gets crushed between the epiphysis and the diaphysis. Okay, so the epiphyseal plates get crushed. So this is crush injury of physis. This is very, very severe. It causes growth problem. Sixth is very rare type, not seen much. So these are the commonly seen type in Salter-Harris classification. And in type 2, you see one triangular area created here. This triangular area created here is called as Thurston-Holland-Sein. Thurston-Holland-Sein is called as type 2 Salter-Harris classification. This is called as Thurston-Holland-Sein. So these are the various types of epiphyseal injury which can happen. One is separation. 2 is part of the bone above the epiphysis gets affected. 3 is part of the bone below the epiphysis gets affected. 4 is across the epiphysis fracture line runs. And 5 is crushing of the epiphysis. Okay, so this is about the Salter-Harris classification, frequently asked topic in fractures of the children. Okay.